Welcome to the Zenix Hospital in-service tutorial video series. This series provides detailed information about the Zenix Monitor Defibrillator and its functionality. These videos serve as an adjunct to formal training. Please take time to read the operator's guide available online at zoll.com. Obtain formal training from an appropriate authority before using Zenix for patient care. In this video, we review testing and manual defibrillation using internal paddles with the Zenix Monitor Defibrillator. First, inspect the connector contact sockets for damage or corrosion. If damage or corrosion is found, remove the handle set from use. Connect the internal handles to the Zenix multifunction cable and power on Zenix. If your paddles have a discharge button, press the button to verify that there is an audible click and that the button springs back on release. To test the internal paddles, charge Zenix to 2 joules. Wait for the ready tone. During the ready tone, hold both internal handles and paddles out and away from any person or object. Then, press and hold the discharge button located on the right handle to simulate energy delivery. Verify that Zenix does not discharge and the error messages "Apply paddles" and "Check defib paddles" appear on screen. Disarm the device after verifying these messages. The next test ensures the integrity of the high-voltage wiring in the handle set. Provider 1 presses the surfaces of the spoon heads firmly together. Provider 2 selects the 30-joule self-test key. Provider 1 presses and holds the discharge button on the apex handle until Zenix delivers the selected energy. A 30J self-test passed message appears. To defibrillate with internal paddles, Provider 1 uses the Energy Select key to choose the desired energy level, then presses the charge button. Provider 2 positions the paddles according to the local protocol and discharges the energy to the patient. We have now reviewed testing with internal paddles and manual defibrillation using the Zenix Monitor Defibrillator.